X-ray. This is the oldest and most widely used type of medical imaging, working by passing a small amount of radiation through the body to capture a picture of dense structures like bone. Soft tissue barely shows up on the image, which is exactly why X-rays remain the fastest way to spot a broken bone or a swallowed object. The technology dates back to 1895, when Wilhelm Röntgen discovered the rays almost by accident while experimenting with cathode tubes. Despite newer scanning methods available today, X-rays are still the first choice for many quick diagnostic checks because they are fast, affordable, and require very little preparation. CT scan. A computed tomography scan takes the basic idea of an X-ray and multiplies it, rotating a beam around the body to capture dozens of cross-sectional images that a computer then stitches together into a detailed, three-dimensional view. This layered approach reveals soft tissue, blood vessels, and organs with far more clarity than a standard X-ray ever could. CT scans became widely available in hospitals during the 1970s and quickly transformed emergency medicine, since doctors could suddenly see internal bleeding or organ damage within minutes. The trade-off is a higher dose of radiation than a single X-ray, so CT scans are reserved for situations where that extra detail truly matters. MRI. Magnetic resonance imaging uses a powerful magnetic field and radio waves instead of radiation, aligning water molecules in the body and measuring how they respond to produce an image. This makes MRI especially good at showing soft tissue like the brain, spinal cord, muscles, and ligaments in remarkable detail. Because there's no radiation involved, it's considered safer for repeated use, though the machine's loud noise and enclosed tube can make the experience uncomfortable for some patients. Development of the technology in the 1970s and 1980s opened up a way to study the brain and nervous system without ever needing to operate. Ultrasound. This scan uses high-frequency sound waves instead of radiation or magnets, sending pulses into the body and reading the echoes that bounce back to build a live image. It's the same principle sonar uses underwater, adapted for the human body. Ultrasound is completely painless, involves no radiation, and produces results in real time, which is part of why it's the go-to method for monitoring pregnancy. Beyond obstetrics, it's also used to examine the heart, abdominal organs, and blood flow through vessels, often as a quick first step before deciding whether a more detailed scan is needed. PET scan. A positron emission tomography scan works differently from the others by tracking how the body uses energy rather than simply capturing its shape. A small amount of radioactive tracer, usually attached to a sugar molecule, is injected into the bloodstream, and the scanner detects where that tracer accumulates most. Since cancer cells and areas of high brain activity tend to consume more sugar than surrounding tissue, PET scans are particularly useful for spotting tumors, tracking how cancer responds to treatment, and studying conditions like Alzheimer's disease. It's often combined with a CT scan in the same session to overlay function with structure. Mammogram. This is a specialized low-dose X-ray designed specifically to examine breast tissue, using gentle compression to spread the tissue out for a clearer image. The compression, while uncomfortable, reduces the radiation needed and helps prevent overlapping tissue from hiding small abnormalities. Mammograms became a standard screening tool in the latter half of the 20th century as breast cancer detection improved dramatically with earlier diagnosis. Regular screening starting at a certain age is now widely recommended precisely because this scan can catch changes long before they can be felt. Bone density scan. Also known as a DEXA scan, this test measures how much calcium and mineral content exists in the bones, using a very low dose of X-ray to do so. It's the primary tool for diagnosing osteoporosis, a condition where bones gradually become fragile and more prone to fractures, often without any obvious symptoms until a break occurs. The scan is quick, painless, and involves far less radiation than a standard X-ray, making it suitable for routine monitoring, especially in older adults or those with risk factors for bone loss. Echocardiogram. This is essentially an ultrasound focused entirely on the heart, using sound waves to create a moving image of the heart chambers, valves, and blood flow in real time. Unlike a still X-ray, An echocardiogram shows the heart actually beating, which allows doctors to measure how efficiently it's pumping and spot problems like leaky valves or weakened heart muscle. There's no radiation involved, and the test is often performed by simply placing a probe against the chest. It has become one of the most common ways to evaluate heart function without needing an invasive procedure. Angiogram. This scan focuses specifically on blood vessels using a contrast dye injected into the bloodstream to make arteries and veins visible on an X-ray or CT scan that would otherwise be hard to distinguish from surrounding tissue. It's especially valuable for detecting blockages, aneurysms, or narrowed arteries, particularly around the heart and brain. In many cases, an angiogram isn't just diagnostic, since doctors can immediately follow up with a procedure like inserting a stent through the same access point. This dual purpose makes it a central tool in treating conditions like coronary artery disease. Fluoroscopy. This technique creates a continuous moving X-ray image, essentially functioning like an X-ray video rather than a single still picture. It allows doctors to watch body structures in motion, such as the digestive tract processing a swallowed contrast liquid or a joint moving through its range of motion. Because it involves ongoing radiation exposure rather than a single quick burst, fluoroscopy sessions are kept as short as possible. It's frequently used to guide certain procedures in real time, helping a doctor see exactly where an instrument or catheter is positioned inside the body. Doppler, ultrasound. This is a variation of standard ultrasound, designed specifically to measure movement, most often the flow of blood through veins and arteries. It works by detecting the change in sound wave frequency as blood cells move through a vessel, a principle borrowed from the same effect that makes a passing ambulance siren shift in pitch. Doctors use it to check for blood clots, narrowed arteries, or poor circulation in the legs, and it's a routine part of monitoring blood flow to a developing baby during pregnancy. Because it adds a layer of functional information on top of a regular ultrasound image, it often gets ordered alongside one rather than on its own. MRA. Magnetic resonance angiography borrows the same magnetic technology as a standard MRI, but focuses specifically on blood vessels rather than surrounding tissue. In many cases, it can be performed without any injected contrast dye, which makes it a gentler alternative to a traditional angiogram for patients who need their arteries examined but want to avoid an invasive procedure. It's commonly used to check for aneurysms in the brain, blockages in the neck arteries, or vessel damage anywhere in the body. Since there's no radiation involved, it's also considered a safer option for patients who need repeated vascular monitoring over time. Nuclear bone scan. Unlike a DEXA scan, which measures bone density, this test is designed to detect areas of abnormal activity within the bone itself, such as fractures, infections, or the spread of cancer. A small amount of radioactive material is injected into the bloodstream, and over the next few hours it collects in areas where bone is actively rebuilding itself. A special camera then captures where that material has gathered, lighting up problem areas across the entire skeleton in a single session. This makes it particularly useful for cancer patients, since it can reveal whether disease has spread to bone long before an X-ray would show any visible change. SPECT scan, single photon emission computed tomography, works on a similar principle to a PET scan, using a radioactive tracer injected into the body and a specialized camera to track where it travels. The key difference lies in the type of tracer and camera used, which makes SPECT more widely available and generally less expensive than PET imaging. It's frequently used to study blood flow in the brain, evaluate heart function after a suspected heart attack, and investigate seizure activity that isn't captured well by other scans. The three-dimensional images it produces help doctors see not just where a problem exists, but how actively that area is functioning. Barium study. This test uses a chalky liquid called barium sulfate, which coats the inside of the digestive tract and shows up clearly on X-rays, revealing structures that would otherwise remain invisible. Depending on what part of the digestive system needs examining, the barium can be swallowed for a look at the esophagus and stomach, or introduced from the other end to examine the colon. As the patient moves and the barium travels through the body, A series of X-ray images capture the shape and function of the digestive tract in action. It remains a reliable way to spot ulcers, blockages, or abnormal narrowing, even in an age of more advanced imaging. Myelogram. This procedure combines a contrast dye with either an X-ray or a CT scan to get a detailed look at the spinal canal, the space surrounding the spinal cord and nerve roots. The dye is injected directly into the fluid surrounding the spine through a thin needle, outlining structures that wouldn't otherwise stand out on a plain scan. It's particularly useful for detecting herniated discs, spinal tumors, or narrowing of the spinal canal, especially in patients who can't undergo an MRI due to implanted metal devices. Though largely replaced by MRI for many cases, it remains valuable when a highly detailed view of the spinal nerves is still needed.